No, they're shutting down the government. People would really upset if the NFL will be shut down. People are like, whoa. Yeah, got everybody. Shutting down the government. Oh, my God, what's going to happen? It's amazing how the news covers it, right? Where do we have it? Where they were talking about it?
Yeah, I got that right.
One faction in one house of Congress is ready to bring the entire federal government to a halt.
This is a shutdown brought on by the Republican Party.
It is just incredible to me to watch these Republicans putting on their suicide vests.
What we're seeing happen in America right now, I think, is economic terrorism.
They've been called the Suicide Caucus. It's been called a political hostage-taking. Yes. It's been called political extortion.
The Republicans are saying, give in to us because we don't want, we would rather shut down the government than extend health care to 11 million people.
Laura Ingraham and Ann Coulter started challenging the president's manhood, and the House Republicans started stamping their feet. And the president decided, no, I'm going to scream and yell and shut down the government.
No one knows what the president is willing to sign, where he is willing to compromise, if at all.
The Democrats are defending a principle here that you don't negotiate with terrorists when they're holding hostages, and the president is holding the government hostage.
They are out to prove that they, the Democrats, are the responsible party of government and can bring order to the chaos of Trump's Washington.
35 days. 35 days of federal workers rationing asthma medicine for their kids, sleeping in cars. Yes. This man single-handedly shut down the government. It is shameful.
Yeah. That's how they cover it. So that's why you're hearing it, right? It has been shut down previously. It's terrible that the government has to work this way. They should really balance the budget. They should try to tighten the belt. They should make cuts. I remember one time Rand Paul, maybe his dad, maybe it was Rand Paul, said, if we got a penny from every dollar, then that would balance the budget over 10 years. Then he had to say we cut 10 cents from every dollar. And I think now it's 30 cents, which is now impossible because of entitlements. So what they want to do is they're now, I believe there's two parts of this story. One, the Democrats need to stand up to Donald Trump because he's been steamrolling them and steamrolling the eunuchs that are the Republicans that are in Congress. And he's just plowing over everybody. He's like, go ahead, stop me, sue me, whatever, right? So they can't stop him, so they have to put something. Now they say they like health care because it's like, taking health care away from this person, and people are going to be dying in the streets because, health care because Trump is so bad and the Republicans are so bad. What it's sitting down to is during the lockdown, when under the Biden administration, whoever was in charge, whoever's running the auto pen, they took the number of people that were eligible for Obamacare, for government health insurance, and they extended it out because we're in an emergency. People aren't working. They got rid of the income caps, and they basically just, like a gigantic, like a Huey helicopter, they flew over the country and just showered money down and extended the health care benefits. Now, at this point, the Republicans are like, let's check the calendar. Okay, we're out of the pandemic. Let's bring the number back to where it was before. Instead of the 24 million people that were getting this benefit, let's bring it back. Let's put the checks in place. So if you're making this amount of money, you don't get it. If you're not working, you don't get it. If you're not working part-time, if you're not doing something, you're not going to get it. They want to put some sort of work requirements in place. That was part of the big, beautiful bill. And now it has passed in the House. It's gone to the Senate, and Chuck Schumer's trying to stop it because he wants to sort of take parts of the big, beautiful bill apart. But what you're talking about is spending our tax dollars to provide health care, medical care for people, which is Obamacare, which has not done what it said it's supposed to do. It was supposed to bring down the cost of health care. It hasn't, because what happens is the people that get in, if you forced everybody into the insurance pool, everybody in the pool. So you got 21-year-olds that are in really good shape and 28-year-olds. You got people that are in their 50s. They go to longevity medical clinic. They're in really great shape. You have a big, big pool. So then you have a few, maybe 90% of the people or 80% of the people are healthy, 20% are unhealthy, but everybody's throwing the money in. Now that's a healthy insurance pool. So what happens is then you can afford to have this pool because you've got everybody in, the young, the old, the sick, the not sick. Everybody's in there together. So you have a healthy insurance pool. Well, the way it was worked with Obamacare is the people that are getting in are not as healthy. So it's the pool itself is distorted to a unhealthy, and it doesn't have enough money. So so it needs to be subsidized. So the federal government, in some sort of weird magic trick, is able to continue to fund Obamacare, which is not actually driving down the cost of premiums. So they spread the cost over to the rest of us because Obamacare, 74% of U.S. employers now offer health care to people. And it's amazing. A lot of people are like, I don't want to pay the $20 or $30 or whatever it is a month or $100 and some bucks. I'll just go get Obamacare. So they go in and they get Obamacare, which the rest of us pay for. So everything they say to us, it's going to cover everybody and it's going to drive down premium cost. It doesn't. If you want to get rid of the cost of gigantic healthcare bills, you have to create a marketplace. Perfect example. When I lost my job at King 5, when they fired me, I thought at this point, I got one colonoscopy from King 5. I might as well get another one because everything was all sort of loose back there at the time. So I thought, at this time, I'm going to get a colonoscopy. I didn't have health insurance, so I started calling around all these places. How much does it cost? Can you please hold? I'm on hold. They're playing the music. I'm like, waiting. Do you want to know, like, what we charge? Yeah. If I just want to pay cash. Please hold. More music. Person probably goes, we don't have a price. Oh. So if you went to the grocery store and you filled up your entire cart with everything and they beep, 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 scanned it, you're getting bread, you're getting meat, you're getting all a bunch of fancy European soft cheeses, beep, 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 scans through, and the person goes, that'll be $30. You're like, oh, well, that's cheap. That's your copay. Well, who paid for the rest of the stuff? But if you created a marketplace, then people would be aware of prices. And then all of a sudden, if they got the money away from the employer giving you that, and it was your money, and you could go around and buy what you wanted, just like you buy a car insurance or something, then it would create a real marketplace. Look at LASIK eye surgery. If you look at LASIK eye surgery, when it first started, when it was early in, it was like $5,000 or something. Well, what happened? It wasn't covered by insurance. So other doctors that came along and offered LASIK eye surgery said, well, we're not going to charge $5,000, let's charge $4,000. Somebody else says, hey, let's charge $3,000. And then the industry came in with more advanced technology, which then drove down the price even more. And then I could hear people go, for just $900 an eye. Well, what happened? Oh, I know. It was a marketplace. And these doctors had to compete in order to get customers. Because we do not have a marketplace, because we roll our cart up there and they beep and scan the thing across and we give them $30, we're thinking, oh, it's cheap. Healthcare is cheap. No, it's not. Someone's paying. We're all paying. So there's no price signal. Every price is a signal to the buyer as to whether or not they want to buy that or not. If we, the United States, were to disconnect the employer from the employee, and the employer said to you, hey, we normally have to pay X amount of dollars in order for you to bill. We'll give you that money. And then you could form a buying co-op as well. You could join with others if you wanted to, or on your own. You could go out with your own cash and look around. Well, you've got all this money, and you can go out there into the marketplace. You'd have 150 to 175 million people with cash looking to get health care. They could buy a low price one, a medium price, maybe they're a little older. They could spend even more money if they want. You'd have a healthy marketplace. We do not. And that's why the cost of healthcare is so high, because nobody knows the price of anything. Try calling a doctor and just say, hey, somebody give me a colonoscopy. I know Andrew's going to save that for later on. But because there's no market. So that's why you have these guys in Washington. Oh, we think it's a great idea to extend health care benefits to people that are here in this country illegally. Why? Because they know eventually, if they get control of the Senate and the House again and the White House, they're going to try to get all those people that they gave all these bennies to be able to vote. And then who are they going to vote for? I know, the people that are taking care of my health care, the people that are giving me this and giving me that and giving me this. You go back to Roosevelt when he talked about, we're going to get rid of want and need and shame, where everyone's going to be able to have a meal and everybody's going to have a health care. Where's it coming from, FDR? It's coming from everybody. When the government controls it, you're going to see rationing because that's the only way they'd be able to control the price of anything. They would ration it. So if you're 70 years old, do we really want to spend the money in order to keep you around much longer? Besides, you're not even paying into the system. So what are we going to do for you? The latest health care to keep you around? No, you're a burden on society. So you'll get less care because, well, you're not a functioning member of society and you're not going to be able to pay into the system as long as somebody else. Again, free the American people, disconnect the employer paying for your health care, let people go into the marketplace, let all of these various like flowers bloom, and then everybody goes out there, and then you'll see the price of things like LASIK coming down because there was a marketplace. You'll see other things begin to bloom as well. But as long as it's centrally controlled, whether it's in Canada or the UK, which is in dire straits with their health care, it's a mess. Why? Because rationing is the only way to control the price. And every year in the UK, they say, let's see, how many people do we have? How much money do we have? What can we possibly have? How much we can pay the doctors? Well, that's why no doctor wants to work in the UK, because they don't get paid anything, and it's not worth the experience, and it's not worth the time for them to become a doctor. So they have less and less doctors. When we have less and less doctors, we're going to have to ration even more. That means less. How long is the wait? You get diagnosed with cancer, you're going to be waiting about 2 years or 3 years. And by that time, what they hope for is that you die. The same thing happens in Canada. You wait in a long line to see a general practitioner, then they diagnose you with a problem. You want to get to an MRI. I think there's 3, last time I checked, like 3 or 4 in all of Canada. Why? Because there's no marketplace. You can go get an MRI and you can pay out of your own pocket. I forget, it's not that much money. And you find the results right away because that's a marketplace. If it was open and people could shop, then people would know prices and then there would be competition and the prices would come down. There.
Socialism failing to work as it always
Scully.
does. You talk about giving everybody something free and all of a sudden
free health care.
There's no food to eat.
There's no doctor.
Anyway.
0-2. 0-2.
Okay,
yes,
question.
Joe, question.
Every time this comes up, the text line blows up with people saying that illegal immigrants can't qualify for health care. So is that...
Right here. Yep. Democrats propose would result in $200 billion spent on health care for illegal immigrants and non-citizens over the next decade. That's what they want.
And that's
in
nationally.
the Children's Health Insurance Program. Right now, they're right. The people are writing in. Right now, if you're an illegal immigrant, the federal government will not pay for your health care. So states go, come here to this state, like the state of Washington. We've got $150 million for you. And when people say, if we don't pay for it, they're going to be taking up the emergency room and they're going to become sicker and they're going to do this and that. Well, if you want to be able to have people to come to your state and choose your state over another state, well, fine. And if you want to offer them a whole bunch of benefits they don't have to pay for necessarily and give them all of that, you can do it. Look at the cost just in Chicago alone for housing, for education, for food, for health care. There are people that have been going to city council meetings and screaming at the mayor, Mayor Johnson there in Chicago, saying, I've lived in this city for 50 years, and you're taking my tax dollars and giving it to people that have just come here into this country illegally. People are rising up against it, even in Democratic cities, but certainly not in the state of Washington, where our legislators are like, it's not fair to these people. Yeah, maybe they're undocumented, but eventually they'll become documented, and eventually, so we need to take care of them now. That's a whole separate issue. But if you just want to solve it for everybody else and get rid of Obamacare, which has failed in every single one of its goals, which is reducing premiums, having more people insured, it's failed every single time. And it's being funded in some sort of weird behind the screen. No one knows where it's coming from. Nobody wants to say anything about it because if you're a Republican and you talk about actually cutting or making stuff responsible, you'll see, as you just seen that Joe played for you, all the news. People are dying because Republicans are bad. Solve the problem by getting the government out of it. I hope Roosevelt is spinning around in his grave. His mom used to come to the White House and give him a brown bag full of cash.
I hadn't heard that one.
Oh, yeah. Look that up. Look that one up. Look that up in the book. That guy. There will be no more need and no more want. Everyone will have food and a place to live. Okay. Won't be a nice place. Won't be nice food. But everyone will be fed because we're that kind of a great country. Good job, Roosevelt. And he wanted to get his own judges on there. And he's like, let's get more judges. Let's just put more judges on there. But talk about an authoritarian dictator.